From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Tuesday, July 21st, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Over the weekend, state health officials began releasing new data on COVID-19 hospitalizations that provides more detail on how regions of the state are grappling with the disease's sickest patients. The North Carolina Department of Health and Human Services Coronavirus Dashboard now breaks down hospitalization numbers by, quote, healthcare preparedness coalitions, broad collections of counties centered around a major trauma hospital. The data, which shows about a month of trends, also includes details on patients in intensive care beds with the disease. Two regions in particular, the Metrolina Healthcare Preparedness Coalition around Charlotte and the Triad Healthcare Preparedness Coalition in the northwestern part of the state, have seen steady increases that have kept their COVID-19 patient counts near the 300 mark. Together, the two regions make up about half of the state's total hospitalizations from the disease, according to data as of July 20th. The data also shows for the first time how many patients in North Carolina are in hospital intensive care beds, statewide and across the 8 regions. As of July 20th, 320 patients were in ICUs with COVID-19, less than one-third of the total number of patients hospitalized with the disease. That means about 10% of the state's more than 3,000 intensive care beds are filled with COVID-19 patients. The data itself is still sourced from a survey sent to hospitals daily to track bed capacity and other metrics. Hospitalization totals have historically varied day to day when the response rate drops. But state health officials have now moved to a more automated process to administer that survey, the pilot project for which began in mid-April. A message on the dashboard says, quote, there will be a small shift in hospitalization numbers because of that switch. In June, a group of public health experts also used regional data from DHHS to examine and forecast hospital capacity. That study found uneven impacts on hospitals, with particular stress on those in the Greenville, Charlotte, and Triangle areas. Cumberland County Schools will operate under Plan C, all remote learning, for at least the first 6 weeks of school. School starts on August 17th, and per unanimous vote from the Cumberland County Board of Education, students will learn from home through at least September 25th. Cumberland County Schools Superintendent Marvin Connolly Jr. said the goal will be to eventually move to Plan B, a mixture of in-classroom and remote learning, at some point in the semester. The decision to move to Plan B will be considered in late September if deemed safe by public health officials. Connolly recommended that officials look at virus trends every 3 weeks to determine if it is okay to move forward. Wake County School Board members met today to vote on the district's plans for the coming school year as well. You can find the latest on that on our website, and we'll cover any announcements in tomorrow's news brief. Yesterday, Raleigh Mayor Mary-Ann Baldwin issued an emergency proclamation prohibiting the sale of alcoholic beverages between 11 p.m. and 7 a.m. The order comes after Baldwin announced her intention to institute such an order last Friday. The new requirement is an effort to curb the spread of coronavirus. People have been congregating in large crowds at restaurants that serve alcohol late into the night, causing concern due to the lack of social distancing taking place. Last month, Baldwin said she was concerned after crowds gathered outside restaurants in Raleigh's Glenwood South neighborhood. Long lines with little to no social distancing formed as patrons waited to get inside, and few people wore masks. Glenwood South restaurants like Southern Chard and Hibernian Pub voluntarily cut off alcohol sales early last Friday night. Baldwin's order not only prevents restaurants from selling alcohol after 11, but also bans sales at convenience and grocery stores. This makes it more restrictive than the countywide order put into effect in Orange County just recently. And lastly, Wake County Public Library's Books on the Go curbside service is proving popular. On Monday, the county estimated that more than 143,000 reserves on books and other materials were placed in its first month, and said it's adding 2 new locations. Wake County closed libraries down in March because of the pandemic and launched the curbside service on June 15th. Here's how it works. You can go to Wake County's online catalog and place a reserve on the books you want to check out. You'll need a Wake County library card to request the books, but you can register for a card online. When the books are available, the library will email you instructions on how to pick them up. You'll have the chance to select when you want to pick up your books and the library location where you want to get them. Appointment times take place from 10 a.m. to 6 p.m. weekdays, and you'll have 10 days to get them. Wake County opened Books on the Go with 8 pickup locations around Raleigh. Now, because of the popularity, 2 more locations are opening: the Fuquay-Varina Community Library and the Express Library on Fayetteville Street in Raleigh. Wake libraries also offer a host of remote activities, including story times, ebooks, and more. This has been your Coronavirus North Carolina News Brief for Tuesday, July 21st, 2020. If you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.